and I'll hand it over to him to conduct the proceedings. Dr. Jha?
Thanks, Suresh, and welcome everyone to this webinar. And as you have seen from the name or the title of the webinar, given that we are in the month of March, we are focusing on the World Kidney Day, which falls on the second Thursday of every March. And we are deliberately doing it a little away from the actual day because that day is really very busy with a range of activities, which is a testimony to the success of the World Kidney Day. I am of a generation which has the unique distinction of having been between the initial pioneers, so the people who actually came up with the idea of World Kidney Day in the early 2000s when we were starting to understand what chronic kidney disease is like, how do we measure it, and what can we do about it, even the burden of the disease and its adverse impact on health, etc. So there were visionaries like Bill Cowser, who recently passed away, along with Joel Koppel and Alan Collins, who came up with the idea of the World Kidney Day. And if you go back to 2006, that was the year the first editorial was published on the World Kidney Day, and it was entitled World Kidney Day, and an idea whose time has come, right? So we are almost at the 20-year anniversary of the World Kidney Day, and we have to perhaps take a step back and see whether it remains relevant to us. And if it does so, in what way does it remain relevant to all of us today? To have that discussion, we have four excellent leaders in nephrology with us, representing diverse viewpoints. We have Professor Sreejith Parameswaran from JIPMER Pondicherry. He's an academic, a researcher, but also someone who really set up the Department of Nephrology from scratch, and he remains involved in a range of activities. And to complement him, we have Ms. Vasundhara Raghavan, who is an activist and an advocate from civil society, having been involved both with the care of people with kidney disease and being a kidney donor herself. She runs an organization called the Kidney Warriors Foundation, and Kidney Warriors Foundation has done exemplary work in raising awareness about kidney disease. So we'll hear from the two of them, and then we'll go to a panel discussion, and I'll introduce the panelists a little later. But it now gives me great pleasure to invite Professor Sreejith Parameswaran to kick off with his reflections on what does he think World Kidney Day represents for all of us today. Over to you, Sreejith.
Thank you, sir, for the kind introduction and asking me to be part of this program. I tried over the next 10 minutes or so, try to...
Can you make your slides full screen, Sreejith?
Okay, just a minute, sir.
At the bottom. Yeah, presentation order. Right bottom.
No, this is not. Just a minute. I'm trying to move this up. Just a minute. Yes, I think it should be full screen now.
Yeah. Yes.
Yeah. So sorry about that. So thanks again. So over the next 10 minutes or so, I would like to recap what I have witnessed about the World Kidney Day and try to summarize what the whole World Kidney Day effort summarizes. Yeah, we all know that the World Kidney Day is celebrated every year on the second Thursday of March. And the first World Kidney Day was in 2006. And I was in nephrology at that point of time. That sounds like a very long period. But yes, yeah, I was part of the first World Kidney Day program. I didn't know at that point of time it was the first World Kidney Day, but I was a non-academic senior resident in nephrology. So I was still in nephrology around 19 years back at SGPGA. And that started as a very small, I remember everybody assembled at the seminar room. And that was largely a brief session talking about kidney disease awareness. The mission was to raise awareness about kidney health and the prevention of kidney diseases. We also know that it has grown over the years, and now it is a international effort led by International Society of Nephrology and the International Federation of Kidney Foundations, World Kidney Alliance, and they have a steering committee with representatives from all parts of the globe. You will see Dr. Gopalakrishnan and Dr. Manjusha from India as being part of the steering committee. And the stated mission of World Kidney Day is to raise awareness on the importance of our kidney to overall health and to reduce the frequency and impact of kidney disease and its associated health problems worldwide. So this usually we have these sessions as nephrologist professionals. We have regular sessions which are CMEs where we try to learn and teach our own professional colleagues. But the World Kidney Day, as is evident, is a little different. We are trying to address the, I would say, the general public, not including people with kidney disease, but not necessarily. And but I do think that there is some role of educating our own professional colleagues, but the audience, the target audience is much wider. And this is one occasion where I think the program is designed for a much wider audience other than the usually the sessions oriented towards educating ourselves. So that I think is a very important aspect of World Kidney Day. If you look at what this means, there are 7 components to the efforts of World Kidney Day. One is to raise awareness about our amazing kidneys, which I think nephrologists may find this whether it is really important. But I'm sure most of you also would have seen. I keep seeing patients who people who come with kidney disease, but they don't know about kidney. Okay, they have kidney disease, and there are a proportion of people who think their testis is the kidney, and they will try to come to us with the kidney problem, and they have is hydrocele or some testicular complaint. So yes, we need to have conversation on what exactly are kidneys, because they are not easily visible, and the awareness is less compared to say heart or liver disease. So this I think is important. Then the World Kidney Day themes usually try to highlight diabetes and high blood pressure as the common risk factors for CKD, which again I think is very, very important because the prevalence of diabetes, hypertension all are improving and increasing. And the generally people tend to avoid taking medicines. If they take medicines, they don't monitor treatment. And I would say even worse is that people going on for alternative therapy, thinking that they don't have side effects. But we know that these are well-known risk factors for kidney disease, and identifying, managing them is very important to prevent kidney disease. So the theme is mostly towards prevention. Then encouraging systematic screening of people with risk factors. Most common is diabetes and hypertension, so that kidney disease is detected at a very early stage is also very important. I'll be coming to that point later on also. And in general, as a general population-wide effort, improving encourage preventive behaviors. That is basically improving your lifestyle, be it diet, physical activity, and looking at what you eat and how you eat. So all those things are important for your overall health as well as for the kidney health. Educating medical professionals also, I think, is a very, very important. I feel very strongly about this because even these, and I would say this is even more relevant today, where there is no role, I believe, for what we call therapeutic nihilism in the treatment of kidney disease, CKD especially, because we are seeing more and more very effective therapeutic options coming up. But unfortunately, we do see that we do feel that awareness about these drugs and their benefits are poor even among medical professionals, practically resulting in medical nihilism, which is, I would say, tragic in this day and our times. Okay, we may have better drugs even in the future, but then I think already there are enough interventions which we all know has to be implemented early in the disease. That is the key. So unless we identify them early and unless we implement these measures early, this is not going to be useful, even though we have some tools now. So educating medical professions is also part of the World Kidney Day effort. And then health policy, we all know that has significant role to play. So interacting and improving awareness and involving health authorities in controlling the CKD epidemic is part of the effort. And then also, once you have kidney failure, promoting transplantation as the best option, be it quality of life, lifespan, or from cost effectiveness, transplantation is the most favored treatment option. So that needs organ donation. So I think this slide will summarize what all activities are focused on in normally in the context of World Kidney Day. So basically, it comes down to education of the public, of people with kidney disease, as well as professionals involved in the care of people with diabetes, hypertension, I would say, and not only kidney disease. Early detection is becoming increasingly important, and it can be done by very simple tests, we know, and global advocacy and lifestyle awareness. So these four, I believe, are the key or the pillars of activities of World Kidney Day. And the World Kidney Day themes over the years, I tried to collect the themes over last 19 years. You can see that most of them are broad themes addressing prevention of kidney disease, early detection, improving lifestyle, as well as improving promoting equity and access to kidney care. Right. So this has gone on for 19 years. So then what is the impact? It's very evident that World Kidney Day effort has grown over the years. And I can tell you that JIPMER, for last 15 years, we have had World Kidney Day, except during the COVID couple of years. And even for us, we can see that the reception to these events have significantly improved. So this is one occasion where the department here, we try to organize a public-oriented program. Usually it's a half-day panel discussion and interactive sessions we do regularly. And usually we have attendance of about 200 or so. And we try to, also partner with the All India Radio and Doordarshan in Pondicherry to conduct kidney health awareness programs. So if you look at the World Kidney Day impact, I think this can be assessed based on even participation, which is important. How much of this get covered? So we need to make some noise, and this is very important component of that. Engagement with the community, healthcare professionals, policy makers, awareness metrics, like you can have metrics which can be measured. I'm not aware of any scientific study, but then if you look at the data available with the World Kidney Day website itself, I would say it is quite amazing. There is a significant presence on social media, and there is significant engagement on social media, and even with the traditional media, there is the World Kidney Day events are taken up in a big way from the data which is available. The World Kidney Day is now celebrated in over 90 countries. This is from 2024 data, and I'm sure it is probably bigger in 2025. And of course, there are options for you to upload the activities on World Kidney Day website. Usually, there is a plethora of activities involving celebrities. You can see Surya is a well-known superstar in the Tamil. He is well known for promoting kidney health, along with I'm sure, I think he's involved with the Tanker Foundation as well. He's a well-known figure in kidney health education. He is involved with reducing salt intake. So similarly, from around the world, World Kidney Day collaborates with celebrities, and there are landmarks that are highlighted to put across the message of kidney health. Uh, the World Kidney Day collaborates with international organizations, WHO, United Nations, European Union, and the Ministry of Health in various countries. So I think it is safe to say that the World Kidney Day has had its impact. It has definitely grown in its visibility, and I think the educational efforts, and I think impact in the form of education. Whether these are translating into improved clinical outcomes for patients and overall, that I think I'm not aware of data, but I would assume that yes, that must be contributing. This definitely has far-reaching. It is not about kidney health, but I think this has far-reaching consequences with regard to, say, reduction of healthcare costs, because kidney disease, kidney failure is expensive to treat, be it dialysis or transplant. So early detection and slowing retardation of progression of kidney disease is possible, and improving the quality of life. All these are, I'm sure, have far-reaching and profound implications for the wider community, primarily people with kidney disease. And I that's what I wanted to. That's all I wanted to summarize in the brief 10-minute period given to me. I would end with the this year's World Kidney Day theme, again on early detection and protecting kidney health. Thank you once again, Dr. Suresh, as well as Dr. Jha, for having me. Thank you.
Thank you very much, Sreejith, for that summarization and recounting, providing the broad overview of what kidney health is all about and how the global community has approached it and what's been its significance. So, if we pass on to the other, large group on which the World Kidney Day was originally focused, that of the civil society, as you said, Professor Sreejith. The initial role was to make the general community aware of the importance of kidneys, your amazing kidneys, starting from that. So the initial message of the World Kidney Day was very simple. The World Kidney Day had three messages. Chronic kidney disease is common, chronic kidney disease is harmful, but the last one was the most important and the most optimistic one. It was that we can actually do something about it. And that has become even more true, as you said, Professor Sreejith, with the availability of newer therapies, which can effectively slow down the progression of chronic kidney disease and prevent the development of complications. So what really it all means, and unless the community to which it is ultimately directed, which is the people with kidney disease and people at risk of developing kidney disease, unless we are an equal partners, or rather in some ways make them even bigger partners in this effort, the success of World Kidney Day will remain incomplete. So it is my pleasure now to invite Ms. Vasundhara Raghavan to tell us from her vantage point what she think of what the importance of World Kidney Day is to the community in general, and how has it empowered people with kidney disease in achieving better health care. Over to you, Ms. Raghavan. Do we have Ms. Vasundhara Raghavan?
Yes, I'm here. Thank you, Dr. Jha, for giving me this opportunity. And thank you, Dr. Suresh, to also have reached out to me for this. And I will just start my presentation. So the topic is a little tough for me to actually handle. So it is importance of community and patient involvement in the World Kidney Day. I have actually felt that the World Kidney Day has achieved its momentum, and now it needs to take some sort of a direction. And this is what my presentation is going to talk about. Some way of taking this whole concept forward. So I just looked at what AI had to say on nephrology, which is a study of kidney health and disease that emerged as a distinct medical specialty in the mid-20th century, spurred by advancements in dialysis, kidney transplantation, and renal biopsy, along with increased research into kidney function. So a lot of contribution came from people like Richard Bright and Kolb in dialysis, and bringing out a lot of information on the Bright's disease. And this is what I have seen and realized, that we had a trajectory was there. There was a science and a research that happened, and we had specialized doctors, the nephrologists. Then came the community, the pharmacists, the news reporters, policy makers. And the patient was always there, but what were they doing? I'm taking you through a book that I had co-authored, Who Dies with Kidney Disease, which has traced the historic developments in nephrology, kidney disease, patient health management. I came across a case of a family where the son and mother were both waiting for a transplant. This is an old story. In 1936, the mother, a 6-year-old, was detected with Bright's disease, and she began dialysis 5 decades later. So the amount of work has gone, the parents have taken very good care of the little girl, and she could also manage her health. And then she developed hypertension and began dialysis 5 decades later. And then I have Magda Bonacina, a friend from Italy with IgA. She was walking to school during the post-World War period, and she was wearing clothes which were unusual, wearing protective clothes, whereas all the girls then going to school were wearing frocks. She was wearing pantyhose, and she had covered her head because her mother was very worried about her cold and cough. So she didn't know that IgA was round the corner. But my friend had IgA, maintained it for 30 years, and then had a transplant. Then I have a case of a 14-year-old, Thomas Lay, who started his dialysis in 1970 in a hospital in Heidelberg. He died a few years back after 50 years on dialysis. So this was a period of fear. There was awe. There was a lot of development, science and research. There was a period where nephrology gained momentum. The pharma was involved. And then there was a period when the Congress also approved Medicare. The media was also involved through the transplant stages. So what has happened to the patients? With rising disease, it has impacted the patients. The people who were reticent kidney patients before are now willing to talk. They want to share their personal journeys and bring in more understanding of the disease for the common people. Their disease, their pain gets noticed as they talk about their journey. So using the patients and their stories, the lived experiences, that is a powerful tool for us to actually look at prevention in a larger way. So for a big change that we need, the sea change that we want, we need the patients and the patient body to be effective in taking this initiative forward. Patients need to be empowered to propel us to achieve. They can do counseling, they can do organ donation drives, they can push the prevention agenda, they can help in course correction and treatments, and talk to policymakers. Course correction and treatments is only a feedback mechanism where patients are talking about what experiences they had during their treatments. That can also help the nephrology community to react on and to make the necessary changes. So the journey of change, Kidney Warriors Foundation has been involved. We have Yangchung Dolma in Delhi, who attends all these non-communicable disease workshops. And we have had about 30 patients who were involved to talk at various occasions, thanks to Boehringer Ingelheim. They had approached us, and they had 30 people from across the country talking at different events. So what happened is, at the end of the talk, there was a lot of excitement. They came back saying, listen, we need to do this more. We would like to talk about our experiences. But that is a platform that we need to create at all nephrology conferences, even if it's just an hour, when the patients can come and talk, maybe 1 or 2 patients. And also the doctors can give a feedback on solve all their problems, all the issues that they have. Q&A sessions can be there. So this can be integrated into our, at least in the Indian Society of Nephrology can start this, because I think in India we have a huge potential with lots of people wanting to convey their stories, and also there is a lot of learning that we can take forward. This is the way we have been employed. Our patient organizations have been working across, talking in schools for organ donation, and we were promoting the organ donation. We've done walks in Kolkata. There is a dialysis technologist who is a founder member of Kidney Warriors Foundation, and he does these annual events. Dr. Rajiv Sinha was there this year, and Dr. Prasun Das and others have also participated. He makes this very interesting program where he makes the doctors talk about, actually have the charts open and explain what this is and what is a kidney disease and whatnot. So it's a very interesting program that he does. Last year, we opened a Thane Health Welfare Circle in Mumbai, in Thane. And we had nephrologists, diabetologists, cardiologists, and Mohan Foundation is there with us for this program. So we keep doing small events in Thane, so that can be something like taking one district and working there can make a difference to, that is how patients can engage themselves. So we did an awareness with taxi drivers and auto drivers. They had put up these posters in their vehicle and carried it on for the whole day. Then we had a camp where we did some small screening camp with security guards and cab drivers. And we realized that security guards sitting alone by the, sitting and doing nothing at all with no exercise are probably the ones at great risk, because their HB1AC was quite high. And we are now medicating 3 of them. We did community work with kids. We actually had the school teachers talk about, get involved in projects, science projects for school children. And we had also talked about the lifestyle choices they can make. And we also had one school in Madurai participate. And interestingly, the school is in the outskirts of Madurai city. So they are not exposed to Swiggy. So they have a very good opportunity of learning to cook in school and being self-sufficient in later years. This year, to complete the circle, Dr. Nivruti Hase invited Kidney Warriors Foundation to Jupiter Hospital, and he spoke about, are your kidneys okay? He had his healthcare workers, the dialysis technician, the radiologist, and some of the doctors had come. So totally 51 people attended, and we spoke about the patient advocacy work that we do and how the advocacy work can really change the whole scene for healthcare. And we aim to take this forward in Jupiter Hospital to have in-house meetings, having the cardiologist, diabetologist, and nephrologist, having a program within the hospital setting. So, there's no extra expenditure. The hospital has patients coming. If we have interesting topics like how to reduce your creatinine, maybe you'll have a lot of people in the diabetes, people with diabetes and hypertension would also join. Because now the problem is, once you're detected with with hypertension and diabetes, you're taking your medication, you've gone home, you don't go back to your doctor regularly. So that is a big challenge. Anyway, the fear of kidney disease is so much that they will definitely want to avoid repeated visits to the doctors. Thank you very much. And that's all that I have to say.
Thank you very much, Vasundhara ji, for your insights. It's really important, as you said, for the civil society to be involved in these kind of initiatives. And now there is a saying from the point of view of people with lived experience of any condition, right? That nothing should be done for them without them. And so it's really important and great to see that you and other members of civil society who have an experience of
the condition that we are all talking about, lend your voice and lend your weight behind this campaign. It's important. And all of us are now of an age where we have experienced some illness or the other. And we know that unless you have experienced that illness that you're talking about, you really don't know or don't fully appreciate what it means to not be in full health. I can tell you that from my own experience, and I hope and pray that none of you have had that kind of experience, but I'm sure you know someone in your family who has it. So thank you very much for your words there, and we'll come back during the discussion. And now it's really my pleasure to introduce the two panelists. So we have Dr. Rajiv Sinha. He is a pediatric nephrologist, another important group that often doesn't get sufficient airtime, I would say, is the group of children. And children have their unique needs, children have their unique challenges, and children have their unique solutions as well. And that's something that pediatricians only know. We don't know as being adult physicians and adult nephrologists. I have always had a very, very high degree of respect for my pediatric colleagues. I can tell you from my own training days in after MBBS, I used to be mortally scared of handling children, given the how small they were and how easy it seemed like I could do damage to them instead of helping them. So hats off to my pediatrician colleagues. Later on, of course, during my training at PGI, we were the only folks who were available to take care of adults as well as children. So we did become somewhat adept in managing kids with kidney disease as well. Dr. Rajiv Sinha is in Kolkata. He's involved in clinical care. He's involved in research. He does clinical trials. And he's involved in a number of other activities which has got more to do with implementation of kidney health activities, such as participating in Saving Young Lives program. And you heard from Vasundhara Ji already as to how he contributed to the World Kidney Day event as well. And last but not the least, we have the sole, rather, I mean, in terms of the medical community, we have the female voice here, in addition to Vasundhara, Dr. Mayuri Trivedi, who is a nephrologist in Mumbai. Dr. Mayuri Trivedi is also a kind of an activist promoting the message of kidney health on a number of platforms, including social media. She's very active in a number of in a number of other fora in Mumbai and also nationally as well, in collaboration with colleagues from Mumbai and many other colleagues. So it's great to have you with us as well, Dr. Trivedi, and to you, Dr. Sinha. So maybe I invite you to share your thoughts, but can I also ask you to perhaps just reflect on this a little bit? This is the World Kidney Day, so it's a matter of one day, right? So what does one day matter? Because our message seems to be that we should care for kidney disease throughout the year. So how does one day help? So what is the significance of that one day? If you could reflect from your perspective, and if I might start by inviting you, Mayuri.
Yes, sir. I would agree that one day probably does not really matter, but at least it's one day, and at least on that one day we are sure that we are doing our bit and reminding ourselves that we have to do our bit every day.
Right. So thank you for that. But what are your general reflections about what World Kidney Day means to you? How has it helped you in your own mission of improving kidney health for the people that you see?
So it definitely, there's one thing that is very clear to me, that it is a reminder to myself that, yeah, so as for example, the motto this year was that are your kidneys okay? So it reminds me every day that we need to, probably spread this message of awareness a little more every day. So yes, it does have a meaning for me.
Great. Thank you, Mayuri. So if I can pass to you, Rajiv, please feel free to share your thoughts, but also I would like you to reflect on the questions that I posed to Dr. Trivedi earlier.
Yeah, thank you, sir, first of all, for inviting me. Definitely, one day, if you put it in that way, it sounds a bit crazy that how can a one day change anything? But then, uh, as you just said, that in pediatric, we often don't have focus, and even among the general population, there is a lack of awareness of children having kidney disease. Like as you know that many a time I am asked even by adult doctors कि that बच्चों को भी क्या किडनी में प्रॉब्लम होता है and if, I mean for the general population it must be very strange that the children can also have kidney problems. Children can also go into kidney failure, have dialysis. Children can be hypertensive. So it is nice to have this one day. And what in our institution, what we try to do is we sort of try to make it a month affair. So and we do a series of events so that every over the month it is spread. Definitely, it would have been better if we could do it more regularly. But then definitely even having this as a one day and with the ISN focus on it, that has also inspired many of our pediatric colleagues and pediatric nephrology colleagues to step in. For example, last year the whole West Bengal Academy of Pediatric celebrated this World Kidney Week, and there were events across the West Bengal. So hopefully, with this drop of water into the ocean, ultimately it will make a difference, and there will be more awareness of the pediatric kidney disease. Because as you'd agree that this is one of the if we say that prevention is the better than cure, this is definitely really matters. Like identifying children with kidney disease at an early stage can definitely delay the CKD, if not prevent it.
Yeah, thank you. Just staying on that message, Dr. Sinha, a number of kidney diseases in children are actually not preventable, right? Because they develop congenital and hereditary conditions, and there is not much you can do to prevent the progression in those children. So, how do you shape the message of the World Kidney Day, where there is a huge amount of focus on prevention? I'm not at all suggesting that no kidney disease in children can be prevented. Of course, a large proportion of kidney disease can be prevented. But how do you craft this message and give hope still to people or parents of the children who have a kind of kidney disease where you cannot do a lot for prevention?
In that only we slightly disagree. For example, we are still getting children at around 1 year, 1.5 year with posterior urethral valve. And they were dribbling right from the start, and they have been told, counseled by the family members, by the elders, as well as unfortunately sometimes with the medical community, that bada hone se theek ho jayega. So and as you know that is one of the important cause of CKD. So in our message, we are saying that if your child is dribbling, if your child is incontinent, if your child had a meningomyelocele and that was operated, but then you are not following up, because that again a CIC can prevent a end-stage kidney disease. So that is very important message that we would like to spread. And from our pediatric nephrology community, we are encouraging this message for the pediatricians to spread, and for also the pediatric urologists. Because I personally feel, for example, I'm very passionate about this neurogenic bladder. Neurogenic bladder going into end-stage kidney disease, I feel it is a criminal negligence. Because if we start doing CIC right from day one, most of the time this can be prevented. The other things are unfortunately in children, they are diagnosed a bit late because they have a non-oliguric CKD, non-oliguric chronic kidney disease. And this something, again, people are not aware of. In adult, it is more easy. Often they have a oliguria. And we see regularly children diagnosed late was having failure to thrive, or was having anemia, was given recurrent blood transfusion, but there is not general awareness that anemia or failure to thrive can also be from a chronic kidney disease. So these are the things we are trying. Again, another thing is the recurrent UTIs. That can be underlying cause can be again a postural valve or a reflux, and if you prevent recurrent UTIs, maybe you can delay, if not prevent, the CKD progress.
Great, thank you. Thank you for highlighting all of those important points, which should actually give us pause, where as adult nephrologists, we kind of think in a unidimensional manner, but you bring out the multiple dimensions by which kidney disease affects children and how lack of awareness is responsible for unnecessary progression of the disease. And in fact, in some instances, the development of progressive kidney disease can be entirely prevented if intervention is made in a timely manner. And you gave some excellent examples there. So that's important. That also highlights the importance of crafting the message of the World Kidney Day according to the population that we serve. So, for example, the population that Dr. Mayuri Trivedi looks at may not be exactly similar to the population that Dr. Parameswaran caters for, etc. And so we have to tailor our message. So even though there is a global theme and are your kidneys okay? We use that general principle, but we tailor that message to suit the needs of the population that we are going to be working with. So I think coming back, I'd like to now invite our other colleagues, also Dr. Sreejith Parameswaran and Dr. Vasundhara Raghavan, as well as Dr. Suresh Shankar, to give us their thoughts about what they have seen. So, for example, the World Kidney Day said Dr. Sreejith, that even though it was conceptualized in 2003, it came about in 2006 as the first edition of the World Kidney Day. And it has given a number of, it has taken a number of themes during the course of the year. One of the things that we often talk about is screening. And I guess it's also important for us to sort of clarify the message about screening and early detection of the disease. When we say screening, we intend to suggest that we should actually screen the entire population. But we need to know a lot more before we can advocate that approach, whether that is going to be cost effective or not, and so on. So the current understanding is that we should test individuals who are at high risk of developing kidney disease, and they could be individuals with diabetes, hypertension, those with family members who have kidney disease, or who have had other kind of high risk exposure. And they should be tested for kidney disease. So it's early detection rather than others. But again, using this, I think our eventual goal, and I'm sure that you make this this point in your World Kidney Day messages as well, is that eventually we want the governments and we want the multilateral organizations such as the WHO to recognize that kidney disease is an important health threat, and that we should and they should make it one of the important health priorities. So to that end, if we have to think about doing advocacy, what would be your recommendation, Dr. Parameswaran? How can we engage the people who make these kind of decisions? You work in a large public sector hospital, and folks in such institutions have access to corridors of power. So any reflections you have had during the course of your career?
Yeah, thank you for that question, sir. One thing I can assure you is that the awareness has definitely increased. One classical example is what happened in Jimma, to the best of my understanding. They actually designed a school of public health. The proposal was started around 12 years back, and there was no component of kidney disease in that. There was a big NCD component of the School of Public Health, and the School of Public Health has come up now. And this year, we conducted a World Kidney Day program where the theme I had kept as the cardiac, kidney, and metabolic health. And we had involved the PSM colleagues from, and they have, when the public School of Public Health has come up, they have actually added a kidney disease component to the NCD wing of the School of Public Health. And this awareness for the the public health colleagues of our own institution as well as administrators have happened in last 10 years time. So I think that itself is a difference. Quite a bit of data has come up and their awareness has increased. As far as the powers like the minister or the people who influence policy, the one way we have tried is to involve them in activities like, for example, organ donation. We have a cadaver program going on, and that requires a lot of involvement from the police department. So that is for logistic purpose to get things done. But then we have made sure that we conduct awareness programs for them, including the highest level of the SP and the DSPs and the DGs. And so that becomes a opportunity for us to highlight the burden of kidney disease and why this is important, how many people are waiting for kidney transplant, that sort of thing. That is one thing which I think we have tried to do when we get an opportunity where implementing a thing like, for example, we got some funds to set up a dialysis unit. So there was the MP was planning to give that, so they had organized a meeting. So we go there and present the data on how many patients come every week, and mostly I can tell you that on an average we get around 70 new patients with kidney failure every week in Japan. And usually their response has been a shock. Be it the IAS officers or the ministers, because they have no clue of how many patients are suffering from kidney disease. So what I'm trying to say is that there are some role for these people in administering the institutions, and whenever we have had opportunities to interact with them, we have tried to include some data on the burden of kidney disease we are facing. And I think mostly those meetings or instances I think they have found it very informative, and I think that eventually will have some impact.
Great, thank you. Suresh, reflections from you?
I think I agree with Vasundhara in terms of CKDs. The World Kidney Day picking up momentum. One of the areas I feel is still a blind spot is the whole CKD-U issue, meaning it's a lot of non-urban, non-hypertensive, non-diabetics, and especially with climate change, a lot of, I'm sure it's a lot more than what we're seeing in India, isolated spots. So I feel that is an area that we need to turn the spotlight on going forwards. The other part that I have seen, at least in state of Tamil Nadu, is that with regards to government and policy issues, is I do not know whether Dr. Mani's program of the domiciliary approach to kidney disease screening rubbed off on the policymakers or there was conversation. There's a pretty active home-based hypertension and diabetes screening and drug delivery scaled up in Tamil Nadu. What is called, medicine reaching your home. That's in a very simplified way. And I think Vasundhara and their team were witness to a program in Chennai when the state had. I think that's a very good initiative from the policy side. That the way that is the government is stepping into NCD and crossing the accessibility barrier. I think that's one thing. I think the third point I'd like to make is the food plate of people is radically changing, and I think and I'm sure it's going to influence CKD incidents going forwards. And school health, I think those are big areas that I feel that we need to focus on in the future. I think schools have a role to play on the nutrition side and also physical activity. I think those are the macro issues that I see that we could work on going forwards, particularly in the India context.
Thank you, Suresh. Again, thank you for bringing out a number of these points, and certainly they are extremely important. And we have to actually acknowledge the leadership that has been that is evident in certain states, which includes Tamil Nadu and maybe Kerala and maybe a couple of other South Indian states in developing programs to manage these chronic diseases, including chronic kidney disease. And it shows in the health indices, which are far better in these states compared to many others, whether We are talking about North Indian states or Eastern Indian states and so on. So yeah, those points are important. So now passing on to you, Dr. Mayuri Trivedi, how do you think we can further disseminate, use innovative approaches to spread the message of the World Kidney Day, not only on on that one day, but also throughout the year? You have perhaps more experience than all of us here on this panel in using social media and alternative media uh, uh, channels for spreading out these messages. So what advice will you give if we were to ask you that we want to put together something and we are asking you for advice?
Right, sir. So, as you rightly said, that today we are in the age where social media is almost a requirement. Like you'd be really surprised to have somebody who's not on some form of social media at some place. So, definitely, social media does help. If we had to kind of put two and two together, as Dr. Suresh said, that yeah, school screening programs with school children, or at that point of time, it was important to this. So we can include kidney health as an educational tool, maybe at the level of annual days, or maybe their school exhibitions, or the school chats which are there, or as a part of the science projects that the children have. So that would be kind of making use of the children in not only teaching them but also helping us spread messages. The other definite channel which I feel is the YouTube or the Instagram, with this whole culture of reels. So we know that we have a lot of even nephrologists today who are resorting to using this media for promoting small messages, short films, short reels. Something like just asking that is your kidney okay, or say targeting the youth and telling them that you go to the gym, that is fine, but don't use those the gym supplements, or don't use the let's say, for example, semaglutide is all over the place, so don't use that, don't use the anabolic steroids. So targeting that generation, probably in smaller reels or YouTube films. Maybe we can also, like we had the a very big, at least in my childhood, when we went to PVRs or when we went to multiplexes to see movies on the big screen, we had that the cigarette smoking harms, or the cancer kind of message being put in between in the interval or before the beginning of the movie. Maybe it's time that kidneys messages also start coming as onto these platforms, because this would help us reach out to the common man who probably is not that active on social media. So even that would be good, putting up these hoardings on the buses. And so I hail from Bombay, and say the local train is something that is our lifeline, and putting up these small messages on the local train also will help us kind of gain some momentum. That say the heart diseases have gained today, that most people know that heart diseases kill, but I'm not too sure what percentage of people would kind of take a kidney disease seriously. Also taking help of our colleagues, say the endocrinologists or the diabetologists, because the majority of kidney diseases that we face is probably diabetic kidney disease or the metabolic syndromes. So taking help of our colleagues there and kind of including this message in their messages also would be a good way to spread this message that you need to have a kidney which is okay.
Great, thank you. Dr. Sinha, obviously, children are a unique population, but children are also our future, and they're the agents of change. So how do we engage the childhood population, both to inculcate this message in them from a really early age, but also using them to make sure that they go and influence their family, their neighborhoods, their societies in promoting healthy behaviors, not just limited to kidneys, but overall?
Again, I think this is very, very important, and I like the Dr. Mayuri's some of the suggestions, like uh, something like coming, uh, for example, in Calcutta, buses are the lifeline. So promoting the informations in the buses. Uh, what we normally do
Can you
is
focus on, can you
yeah,
focus on the pediatric population,
yeah.
Rajiv?
So like promoting in the buses about the pediatric, yeah, like so that I don't get asked that बच्चों को भी क्या किडनी का प्रॉब्लम होता है. I think that is one of the major thing that has to come out. We have just this year we have started a program where we have identified 5 schools, and we will be doing a skit in these schools as it will be a part of the World Kidney Day activity only, and we will be doing skit where our doctor only from ICH will be doing a small play, and hopefully like that will be making aware in the children in the. I think schooling is something that we are missing. The other thing that we have tried, and maybe not that successfully, but we need to try more, is that involving our own patient, because they can be a great advocate. So this year we had some videos done where our patient, our children were telling about their problem as well as like how they have solved it, and we do encourage the patient interaction. So these are there are a lot of things that can be done, but again like this needs a lot of effort, not from just a single unit, but 360 degree, as well as effort from the government and the NGOs. Vasundhara knows about like I have always been pushing her that how we can increase the awareness among the
Oh,
family about the children, because
yes. Thank
because
you.
whenever I'm asked that कि जब बच्चों का भी किडनी का रोग होता है, I feel very sad that we have failed somewhere.
Yeah, thank you, Rajiv. So you are absolutely right. And we are coming to the end of our time, and it will be only appropriate if we ask Vasundhara ji to perhaps deliver the closing remarks. You did hear a lot from a lot of us, but ultimately it's all in the service of the people who have or who are at risk of developing kidney disease, and people who take care of them, because we often don't talk about the burden that the caregivers face. And you know that more than most, and Rajiv perhaps also has to deal with the parents of a sick child who has kidney disease. And I guess the other message is that for us not to be content with doing a few things around the World Kidney Day, but to use this as a platform to develop a series of activities which continue throughout the year, and target a range of not only a range of audience, but also a range of interventions that we can do. So over to you, Vasundhara ji, for your concluding remarks.
So I just thought about this, that maybe if we could get the government to make short documentaries, about kidney health for kids, and also the adults, and also the information and broadcasting ministry should be to a letter should go telling them that the movies that are being made should not use kidney as something that is to be shocked. It is something that is a very sensitive matter, because people with kidney disease do not like to be seen in that space where people are ridiculing the kidney. So, a strong message from the Indian Society of Nephrology should go, because Indian movies have this in a very large scale. And to have on a serious note, have some documentaries on what this is all about. So that should also help in the long way.
Wonderful. I think on that note, let us conclude this webinar, and I'd like to thank all the speakers and the panelists, and also to NephroPlus team for putting this together, because it's given us an important opportunity to reflect and just assess where we are and where do we need to go from here. So thank you very much for giving me this opportunity to moderate this excellent group of colleagues and experts and people who care about kidney health as much as they do about many other things. So back to you, Suresh, to close the session.
Yeah, thank you, Professor Jha, and speakers and panelists. I think just there was some couple of questions. I found one interesting, couple of them. They said the rise of CKD in Odisha. Dr. Sinha, since he's kind of from that region, is there anything that we are missing here? Or I don't know what the question, Odisha broadly, or this is specifically in Cuttack.
No idea.
I can actually take that on. So I think you are the one who raised the issue of CKD of unknown.
CKD, yeah, correct, I mentioned.
So the Cuttack district is also considered to be one of the lesser known hotspots of CKD, right? So although we know all about Uddanam in Andhra Pradesh and certain areas of Tamil Nadu, and Dr. Parameswaran has published from his institution about Tondai Mandalam and Villupuram and some other districts. And there are reports from Chhattisgarh as well. But these cases have also been popping up in other parts of India, including Odisha. So that's something which we should be mindful of.
Okay. And yeah, I guess one of the questions is also about cutting down cost of CKD. I mean, cost of care is what I suppose the question.
That's better left for another time.
Yeah. I guess early detection is the best way you can have cost-effective kidney care. I guess that's it. I should, on behalf of NephroPlus and our team, I think first and foremost, thank you, Professor Jha, for anchoring this session. As always, you've been the most kind to lead these webinars for us. And thank you, Sreejith and Vasundhara, to being part of it and sharing your candid views on it, on WKD, and to Dr. Sinha and Dr. Mayuri Trivedi too. Thank you, everybody.
All right. Thank you. Bye-bye.
Thank you very much.